Mr. Lopez, you're here for your physical assessment?
Yes,
How are you today?
I'm doing well.
Alright, so do you feel like it's pretty cold outside?
Yeah, it was. It was freezing.
Yeah, it's pretty cold, isn't it? Okay, have a seat right here. Alright, thanks, Nate. Okay, so you're here for your physical assessment. Basically, we're gonna check from head to toe, see if there's any issues or concerns. Do you have any concerns that you would like to tell me about?
No.
Okay, so during the assessment, if anything hurts or if anything is uncomfortable, just let me know and we'll stop or modify, okay?
Okay.
Alright, so just by him walking in, I can already assess different things about him. First, I can tell that his face is symmetric, his posture is erect, his affect is pleasant. Also, when he was walking in, I noticed that his gait was balanced and coordinated. He can hear well because he responds to my questions, and also his speech is articulated. It's not slurred. And I can also tell that he has good hygiene. He looks like his stated age, which is 18. And just from walking in, I can tell those things. So basically right now, I would go into the skin assessment, but I'll be doing that as we visit the different systems. So first, I'll start with his head and face, which is his cranium. I'll be assessing for lumps, bumps, or any infestations or lesions. So I'll just have him go. I'll be feeling around for any lumps, bumps, and I can tell that there's no infestations, and he has a normal cephalic shape. So everything is pretty much good to go there. So now I'll check his face. So just by looking at him, I can tell it's symmetric. Matthew, can you smile for me? Frown, puff your cheeks, raise your eyebrows, and you can relax your face now. Now I want you to close your eyes and don't let me open them, okay? Alright, very good. So that's testing the facial cranial nerve. And now I'm going to ask Matthew to just sit there as I palpate his maxillary and frontal sinuses. Let me know if you feel any tenderness, okay? Nothing? Okay. Now I'm going to move on to his temporal arteries, which are right here. Okay. So I feel a good pulsation, which would be +2 on each side. Now I'm going to ask Matthew to open and close his mouth for me. Alright, so I just assessed his temporomandibular joint. I didn't feel any crepitation or clicks, so it was smooth movement. Alright? Okay, so now we're going to move on to the neck, and as I'm looking, I can tell that it's symmetric. It's proportionate to his head and his chest. Also, the skin color is good, and turgor as well is very good. And now I'm going to inspect his cervical lymph nodes, starting with the preauricular, posterior auricular, occipital, submental, submandibular, jugulodigastric, superficial cervical, posterior cervical. Now I'm going to check your supraclavicular nodes, and I need you to shrug. Okay? Alright. So his nodes were non-palpable, which is good. That's what we want. Okay, so now, Matthew, I'm going to check your trachea. I can see that his trachea is midline and no deviations anywhere. So now, Matthew, I just want you to move your leg there. I'm going to be checking your thyroid gland. So just follow my instructions, okay? I want you to look to the left. Not too much, just a little bit. There we go. And swallow. Okay, very good. Now look to the right. I'm going to deviate his thyroid to the right and feel over here. All right. So there's no swelling or masses, and I didn't feel, it was actually non-palpable, so that's good. And I didn't feel any swelling or any enlargement in any way. Okay? So now we're just going to check your range of motion for your neck. So I'm just going to ask you to touch your chin to your chest. Okay, now hyperextend backwards. Okay, chin, ear to your neck, to your shoulder, other side. So now I want you to look left and right with against pressure, which will be my hands, okay? So look that way. Very good. Look that way. All right, very good. So now I'm gonna move on to his chest. So I'm gonna ask you to remove your shirt so I can properly assess. But before that, I'm gonna inspect his eyes, nose, ears, and mouth. That would have been good to do first. Anyway, are you cold?
No.
Okay, so I'll just inspect your eyes, ears, nose, and mouth first. Okay. All right. So first, I'm going to look at his eyes. So just by looking at him, I can tell that they're symmetric. He has no ptosis or strabismus. He's not cross-eyed. His eyebrows are aligned. So I'm going to palpate his lacrimal gland. Any tenderness?
No.
And his puncta as well? Okay, none? Okay. So from there, I can tell that he has no tenderness or no other concerns that would lead to a further assessment. But now I'm going to check your corneal light reflex. So just look straight ahead, and I'm going to put the light right here. Let me make this smaller. Maybe just take it. Okay, but I can tell from the light that the reflection of the light is in the same places in both his eyeballs. So that is also good for symmetry. And now I'm going to check for pupillary reflex. Just look straight ahead. Very good. All right. Okay, very good. So now we're going to test your extraocular movements, which is the movements of your eye. I want you to put this in front of your eye, and I'll put this in front of mine, and I want you to tell me when you see my hands, okay?
Stop.
Okay. Now we'll do it on the other side.
Stop.
Okay. Do it at the same time. Very good. Now I'm going to ask you to follow my finger. Not moving your head. So right now I'm checking cranial nerves 3, 4, and 6 by checking the 6 cardinal gazes. And that was good. I didn't notice any nystagmus when he was looking into his periphery. And I can document his pupils as perla because they were equal, round, reactive to light, and accommodation. Okay, so I want you to look far away. Okay, look far away, and then look at my finger. Okay, so perla for the pupils. Now I'm going to see if he has a red light reflex in his pupil. So I'm just going to check here. So since I'm going to assess his right eye, because I'm more comfortable with the right eye, I'll be assessing with my right eye. So I've already adjusted. So you can look straight ahead. Okay. So I can see his red light reflex, and I might need you. Oh no, I think you're good. Okay, so now I'm going to check. I'm going to come close to your face to look in the internal structures, okay? Okay. We're going to go one more time. Is that okay?
Mm-hmm.
All right. Okay. So by that, I would look at his retinal vessels, the macula, optic disc, etc. Okay? So after doing that, I would also check his other eye. But we'll just do one eye, one ear for now. So now we're going to move on to the nose. The ears. So just by looking at his ear, I can tell that it's aligned because the tip lines up with his eyes. And there's no discharge. And does this cause any pain or does this hurt? So no tenderness as well. I can also tell that the skin color is appropriate. It matches the rest of his coloration. So right now I'm going to look into his ears and assess and look at his tympanic membrane as well as the canal. Okay? If you feel any tenderness, just let me know. Okay? So I'm just going to deviate his ear up and back and insert the speculum. Okay. So there I noticed that his tympanic membrane was pearly gray. There were no foreign bodies inside, and his canal was pink and no redness or irritation. All right. So now we're going to move on to your nose. So I can see that his nose is symmetric and in line with the rest of his face. So now I'm going to, and there are no lesions or anything like that on the surface. But I'm going to inspect the inside, and I'm going to look at the turbinates as well as the septum. Okay? So I'll also check for patency. You might not be patent right now because you're sniffing. You have sniffles. That's okay. So I want you to cover one nostril and inhale. Same with the other side. Okay. So as you can tell, he's a little sick, but that's okay. We can still inspect.
It's a cold.
Yeah, that's fine. Okay. So just maybe look a little bit up higher for me. And just check inside. Okay, outside. Alright, let me just move on over to this side. Okay. Alright. So his septum is good as well as his turbinates. A little bit of mucus in there, but that was expected. Okay, so now I'm going to inspect his mouth. So I can tell that here he has braces, so I'm going to suspect some lesions, which is normal for people with braces. So I can tell that his mouth is symmetric. There are no lesions or anything like that. I mean, I'm referring to his lips. Okay, so I'm going to ask you to open. Say ah. Okay, so now I'm inspecting his hard and soft palate. I can see he has some metal in there from his braces. No dental caries or lesions. I'm assessing his buccal mucosa as well. I'm just going to get the tongue blade out. And I would normally count his teeth, but he had a couple pulled out before I came. So we would have a little bit less than usual. Okay, so now I'm going to just look at your gums and your teeth. Okay, so very good hygiene. Gums are good, they're not bleeding or anything like that. And let me just check. All right, can you lift up your tongue? All right, now I'm gonna need you to say ah.
Ah.
With your tongue down. Ah.
Ah.
All right, so his uvula is good. Also, his tonsils are +1. They're pretty far from the uvula. Okay? Anything else for the mouth? Let me check. Oh, can you stick out your tongue? Okay, can you say light, tight, dynamite?
Light, tight, dynamite.
I mean, with your tongue in your mouth.
Oh.
Normally.
Oh, okay.
Light, tight, dynamite.
Light, tight, dynamite.
And that is checking cranial nerve 12. Okay? Alright, so now that we've done that, I've already assessed his range of motion for his neck. I've checked his eyes, nose, mouth, and ears. I've checked his thyroid, his cervical nodes. Now I'll move on to his chest. Okay, so maybe I'll have you face this way. Or, yeah, face that way. Okay, so I'm going to assess the back. I can tell that it's symmetric just by looking at it. He is right-handed, so you can, like Dr. Guild said, usually the right side is a little bit more toned. But anyway, so Matthew, I'm going to ask you to shrug your shoulders for me. So he has good symmetry. All right, you can unshrug them. All right, now I'm going to ask you to take a deep breath in and out. So my thumbs moved away, and one wasn't higher than the other. Yeah? So I can tell that he has symmetric lung expansion. By looking at his skin, I can tell that there are no lesions or bumps, a few moles here and there, but nothing of concern. So now that I've inspected, I'm going to palpate. Matthew, could you please say 99 every time I move my hand? Okay, 99 in a deep voice.
99, 99, 99, 99, 99, 99, 99, 99.
Okay, so I didn't feel the vibration dampen, so there's no consolidation or anything of that nature. Okay, so I've inspected, I've palpated. Now I'm going to percuss the lung fields, starting from here. So you can see it's sort of a resonant sound. All right, so it was resonant throughout except when it got here, which would be normal because there are some organs underneath. So now, Matthew, I'm going to check diaphragmatic excursion. Okay. What I'm going to need you to do is take a deep breath in, exhale, and then hold it.
Through my diaphragm.
Yeah.
Okay.
Take a deep breath in, and then exhale, and then hold it, okay? So here there was a change. So that'll be my first mark. All right. Now, Matthew, I'm going to ask you to now I'm going to ask you to exhale, then inhale and hold, okay? Hold. All right, so this would be the next space. And we're going to measure. It should be at least 3 to 5 centimeters, but sometimes in athletic people it will be 7 to 8. So for him, it would be about 6. And he is athletic, so that would be okay. He has and he is a singer as well, so that would attribute to the bigger expansion. All right. So now that we've done that, we've checked, we have inspected, palpated, percussed. Now I'm going to listen to his lung sounds. So Matthew, every time I move my stethoscope, please take a deep breath, okay?
Okay.
Very good. So he has clear breath sounds. I didn't hear any crackles or anything like that, which is good. So now we'll move on to the front of his chest as well. So I'm going to inspect. I can tell that it is symmetric. Once again, coloration is good, no lesions, bumps, or anything of concern. For symmetry, I'm going to do what I did behind. So I need you to take a deep breath. Okay, one more time. One more time. All right, so my hand, my thumbs, and then exhale. Okay, my thumbs moved symmetrically, which means he has good chest expansion. All right, now I'm going to percuss the lung fields. Okay, so let me do that one more time. Alright, okay, so now I'm going to listen to his breath sounds. Deep breath every time I move the stethoscope. Okay, so I had clear bronchovesicular sounds and vesicular sounds as well. Okay, so now I'm gonna assess your range of motion for your upper extremities, okay? So could you please flex, extend? Now flex against pressure, flex, extend. All right. So now I'm gonna assess your wrist, flex, extend, make a fist, or you can, okay, pronation, and all right, very good. And now I'm gonna make a fist again, open, spread your fingers, all right, put them back together, and now I just want you to move your fingers, okay? Flex, extend, all right, very good. And I want you to put your hands in the sky, put them down, try to touch your scalp here like this, so internal rotation is good, all right? And hands down, and now I want you to do arm circles for me, circumduct. Yeah, or just, yeah, okay, that works. Okay, so he has good range of motion, all right? Okay, now I'm going to ask you to lie down. That's our makeshift pillow. Okay? Yeah, put that there. All right, so right now I'm going to inspect his jugular vein. Right now, I can see his pulsation, or maybe you can come on this side. So there's a pulsation, but that could have been his artery. His jugular vein, I'm not able to see it, but that's okay. But if I did, I would use the ruler to measure how high it distends. But he has a normal pulsation there. And while he's here, I'm going to check his carotid. So he has good +2 on each side. I'm going to auscultate for any bruits using the bell. Okay. All right, no bruits. So now I'm going to move down to his chest area, and I'm going to listen. I'm going to assess his heart. So from here, he has no pulsations, which is okay. No heaves or thrills. Chest is symmetric. I haven't assessed thrills yet, but now I'm going to ask you, I'm just going to put my hand to your chest and feel for any thrills. So I don't feel any thrills on the base. No thrills on the apex as well. I'm going to palpate his PMI, which is... Okay, now I want you to turn that way, just for a little bit. Yeah, and then I'm going to palpate just to bring your heart closer to the wall. Okay, so you can come back. All right, so now I'm just going to assess. I've inspected his chest. Now I'm going to palpate. Now I'm going to auscultate his heart sounds. So aortic, pulmonic, herbs, tricuspid, mitral. So I didn't hear any murmurs or S3 sounds or extra heart sounds or S4. All right? You okay? Let me know if you're cold. But now I'm going to move on to the abdomen. So I'm going to inspect. I can tell that there are no pulsations. Let me just shine the light here to see if he has any masses. Just have an oblique light. Okay, no masses. Right, so I'm inspecting. So it's symmetric. His stomach is flat. So now I'm going to auscultate his, first I'm going to auscultate his bowel sounds and followed by his vascular. So for bowel sounds, all I need to use is the diaphragm. Okay, so I'm just gonna listen. Yes, good bowel sounds. As soon as I put my stethoscope down. Yep. Did you just eat?
Yes. How did you know?
I can hear your food. Alright, so now I'm gonna listen to his vascular sounds using the bell. Just picking up vascular sounds. I mean, bowel sounds.
I can feel it.
Okay. No bruise when I was listening for vascular sounds. Bowel sounds are hyperactive, probably times 4, but they're normal bowel sounds. And so now that I've auscultated, I'm going to percuss. Okay. So you can hear there's a change there, probably because there's an air bubble.
Yeah, I feel that.
Okay, so percussion, there's variances, but nothing out of the ordinary. And now I'm going to do deep palpation, okay? Light palpation first. If anything hurts, let me know. No? Okay, now I'm going to go a little bit deeper. Okay, now I'm going to percuss your liver span. So I heard a change right there. Let me grab my marker really quick. There was a change. Okay, so a change right there. So it should be about 6 to 12, but that looks a little small, so I might try that again. Right. Okay, hold on. Okay, so that's the first line. There we go. So it's right here. Just disregard this line. So here would be the appropriate measurement of about 6 to 12 centimeters. So we have about 7. Okay. So I'm going to percuss your spleen as well. Okay. So I just need you to take a deep breath. Okay, and exhale. One more time. And exhale. So there was no change in sound, so no shift to dullness, which is a good thing for the spleen. So now that I've percussed that, I'm going to palpate for your liver border, for liver, to see if I can feel it. So let me just find, okay, now I want you to take a deep breath. All right, exhale. One more deep breath. Okay, exhale. Okay, one more time. Okay, inhale and exhale. Last time. Are you hurting? Okay. So I wasn't able to feel his liver touch my fingers, but can you flex your stomach like I'm about to punch you? Okay, but I won't. All right. Now you can not flex it. Now, 2 deep breaths. Inhale and exhale. Okay, one more time. All right, I think I felt it at that time. Okay? So now I'm going to palpate your kidneys. No tenderness. All right. So spleen is usually non-palpable. All right, so now I'm going to check his aortic pulse, starting wide. Okay. All right, so now that you're still lying down, I am going to check your range of motion of your lower extremities, okay? So can you lift up one leg? All right, very good. Good ROM. Other leg? Okay. You're okay. Now I want you to bend your knee, ouch,
Sorry.
and put to your head, other side. Okay, now take this knee, point it towards me. Does that hurt in any way? Okay. Same with the other one. All right, very good. Okay, so now that we've checked that, okay, so can you point your toes towards your head? Okay, now that way. All right, so he has good range of motion also for his ankles. Okay, so I'm also I would check his pulses, but he's wearing pants right now, so I'll just show you where I would. For his popliteal, right here, and then his dorsalis and tibial would be there. Maybe can you take off your shoe? Okay, all right, so no, right there, good pulse. One right there. Okay, and also as I was doing this, I noticed that his legs were symmetric. One is not longer than the other. And I would also check for things such as hair distribution. Normally after the abdominal inspection, I would also check inguinal and femoral, but both of us aren't comfortable with that, so just so you know, you would have done that. And then, which would have been right in the groin area. And I would inspect that as well, okay? So now I can have you sit up right here at the edge of the bed. Okay, now you can put your shirt back on so you're not cold. Okay. So now we're going to move on to neuro. So basically, again, I'll just show while he's doing that. You would check the inguinal right here, as well as his femoral pulse. And then you would listen to it as well. Okay? Mm-hmm. All right, so now we are going to move on to neuro. I'm going to check the sensation, if you can feel anything on your face. So just tell me if you feel something, okay? Close your eyes. Say now when you feel something.
Now. 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 Now.
Okay. All right, now you can open your eyes. I want you to identify between sharp and dull, okay?
Mm-hmm.
All right, let me know if it's sharp or dull. Close your eyes.
Oh, sorry. Dull. Sharp. Sharp. Oh, sharp. Dull.
Okay, now your arms. Sharp or dull, okay?
Okay. Can you do it again?
Sorry, I should use toothpick or something else. Okay, ready?
Sharp. Sharp. Dull. Sharp. Dull.
Okay. All right. Also your feet and legs as well. Okay, so close your eyes. Hold that for me. Okay.
Dull. Sharp. Dull. 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 Sharp.
Okay. All right, so his sensation is good on his face, arms, and legs. You can put your hands down now. So I'm going to ask you to close your eyes. I'm going to put something in your hand, and you're going to tell me what it is, okay?
G.
Okay, very good. So that was stereognosis. He was able to distinguish. Now I'm going to write a number in your hand, and I want you to tell me what it is.
7.
Okay, very good.
Again. 3.
Very good. Okay. So now we're going to move on to your deep tendon reflexes, all right? Okay, so now we're going to start first with triceps. Okay, I want you to relax your arm like your arm is dead. Okay, very good. So I want you to squeeze your knee.
Why?
That will distract your muscles.
Okay.
Very good. Okay, now I'm going to do your biceps. Okay, squeeze your knee tight.
Okay.
Okay. There we go. Very good. Okay, so now I'm going to do his brachial radialis. Okay, squeezing your knee. Okay, wait, turn him a little this way. There we go. Okay, now I'm going to move on to his patellar. Let me, sorry, well, if I did it this way. Okay. Squeeze your knee, or I want you to go like this and squeeze your elbows.
Okay.
You see the difference? when your muscles are focused on something else, it lets this relax.
Okay.
Yeah? Okay. So now I'm going to do your Achilles. Same thing. Okay? So usually, relax your foot, okay? Relax. There we go. That was a good one. I felt it. Okay. All right. So now I'm going to do the Romberg test. I just need you to stand and close your eyes and just hold that for a little bit. So I'll be here just in case. Usually you would ask them to do this for about 20 seconds, and you can tell he's not swaying or anything like that. Yeah? Okay. So very good. Now I want you to open your eyes and take your heel and move from your shin to your toe. All right, very good. Okay, now shallow knee bend. Bend one knee and just sort of do a dip. Okay, awesome, very good. Now I'm going to ask you to walk a straight line. So follow this line. Maybe face that way. So just walk a straight line for about 5 steps. All right, very good. Now come back. So I can tell that his gait is coordinated and he stays on the line. So now I want to do a heel to toe, like this, on the straight line. Okay, now I want you to walk back on your tiptoes on the line.
Okay.
Okay, and walk back this way on your heels. On your heels. Okay, very good. All right, so now I want you to just face that way. So I didn't get to palpate his spinous processes when I was checking the chest, so that's when I'll just do it right now. So no deviations or anything like that. So I'm going to check the ROM of his spine. Matthew, I just want you to twist laterally this way. Okay, now bend to one side, bend to the other side. I heard a click there. Anyway, oh, that was, okay.
Oh, that was you? Okay.
Anyway, now I want you to touch your toes. Okay, lift up. All right. So you can have a seat. So that was our complete physical assessment I did from head to toe as well as neuro. All findings were normal or within the correct ranges. So do you have any questions for me? Okay, well, thank you so much for your time, Mr. Lopez. I will let the doctor know that my findings are good and you will be good to go. Thank you so much.
Thank you.
All right. Thank you, Virginia.